During the 1980s Japanese economic boom, a large number of deaths were attributed to work exhaustion and sleep deprivation. In most cases of karishi or deaths from overwork, acute cardiovascular events were involved. Sleep disorder affect 50 to 70 million Americans according to the American Sleep Association. 25 million of these people suffer from obstructive sleep apnea, which occurs when the muscles in the back of throat relax too much and prevent normal breathing. According to National Sleep Foundation, many Americans suffer from long-term sleep deprivation. The sleep duration for adults should be between 7 and 9 hours per night. A recent study showed that there are only 48% of US adults report their habitual sleep time falling with that range, and 31% sleep less than 6 hours. It has long been unknown how sleep deprivation affects organ function. However, recent studies have found that sleep deprivation increases the risk of hypertension, coronary heart disease, and diabetes mellitus. Researchers analyzed data collected between 2008 and 2011 from 7,000 men and women between the age of 50 and 75. At the beginning of the study, none of the participants had cardiovascular disease. Physical examination and biological tests were performed on each person. Through a questionnaire, the researchers evaluated the pupils' sleep quality. Participants scored their sleep quality on a scale of 0 to 5. A sleep score of 0 or 1 was achieved by 7% of people, while an optimal sleep score of 5 was achieved by just 10% of participants. Those who had the best quality sleep had a 70% lower risk for cardiovascular disease than people with the worst quality sleep after 8 years of follow-up. It is important to get a good night's sleep in order to reset brain and heart. In the absence of enough sleep, inflammation happens in the body and stress hormones and toxins are not cleared from the brain. At night, these factors can lead to an increase in blood pressure and fluctuation in heart rate. Consequently, this may lead to heart disease such as hypertension, irregular heart rhythm, arterial fibrillation, and possibly poor cognition and memory problems. Okay guys, this was my discussion regarding the helpful benefit of high quality sleep on cardiovascular system. If you have any question, leave a comment below. Make sure to like and subscribe so you could be able to watch my future videos. Thank you for watching and being careful about your health.